1970 when there was no email.
We didn't do pandemics, that's what we did.
Dr. Aiken, has the hospital heard anything from BD on the analyzer? I know we had a big mite or maybe or something, is that right?
On that.
They've been pleasing us all week. On Monday, our lab director got a note that we might have the machine by Friday of next week. And then when he tried to confirm that with the email back to the person from BD, he didn't get a reply right away.
Commissioner said
And
we
then
were ready to
today,
go on.
I guess the fellow
We're ready.
talked with him and said that we might know by this Friday what it's going to be. So it's still, to me, a teaser. I'm hoping that they wouldn't have contacted us and told us that maybe we would have it by next week if there wasn't some reason for that, but they won't confirm it.
All right, well, ladies and gentlemen, let's get started. We're going to start off with the Pledge of Allegiance, so if everybody would stand and face the flag. I pledge
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Welcome, everybody, and for everybody out there that's watching, welcome as well. I don't know if there's comments or not. Is there?
We're not taking comment. There probably is on the YouTube thread, but we're not taking
Okay, all right. Thank you, Shaq, for that. The first thing on the agenda, we're going to start off with introductions, and we'll go to my left here.
Dr. Kent Aiken, Montezuma County Health Physician, and also Director of the Hospitals Program at Southwest Memorial Hospital.
Laurel Schaefer, Assistant Director to Public Health.
Keenan Ertel, Montezuma County Commissioner.
Bobby Locke, Montezuma County Public Health Director.
Jim Candelaria, Montezuma County Commissioner.
Tony Sutta, CEO of Southwest Health.
And I'm Larry Don Sukla, Montezuma County Commissioner as well. First thing on our agenda, we're going to discuss what our goal is, and that is to work together as a team on behalf of the community we all serve to produce a plan that will allow for the suppression of COVID-19 while allowing for the opening of the economy. So, does anybody have any open remarks before we move on to the next agenda item? Very well. We'll move on to the next item, and that is the hospital and the health department concerns regarding rapid testing and how it is a tool that would allow for quick isolation of hotspots and or businesses within the county. So, Dr. Aiken, would you like to lead off with that?
Thank you. There are several types of testing available to determine COVID-19 disease. They all involve the use of a swab in the nose or in the back of the throat that is then analyzed by a machine that will detect the presence of the virus in the secretions that the swab picks up. Currently, most of the testing that is available in Montezuma County and in Southwest Colorado, it requires that we collect the sample and send it away to a reference lab. We've used the state lab in Denver. We've used another reference lab called Quest, which currently is operating out of Kansas City. And then Cedar Diagnostics, which is a private lab in our community, also collects the same samples and can send them to a reference lab, and currently they're using a reference lab in Denver. The problem with that type of testing is the turnaround time. And the turnaround time depends on a couple of things. The first thing that it depends on is the time that it takes for the sample to reach the reference laboratory. And the time depends on the time of day that the sample is collected, and it has to be then sent by a courier, either ground or air, to that reference lab. Usually those couriers go out in the middle of the afternoon, so if someone has a test late on a particular day after the courier has left, Then it's the following afternoon before the test sample leaves our community, and maybe at least 24 to 48 hours once it reaches the lab for a result. At the beginning of the outbreak, there was a problem related to the fact that many of these labs were very overwhelmed. They got bombarded with a lot of test samples. It took them quite a while to process them. Some of them were marked higher priority than others, depending on whether it was a critical patient in the hospital versus someone in the community that might have symptoms but not necessarily be all that ill. And so it took up to a week sometimes to get the results. Lately, the labs have been better at getting caught up, and so now we're looking at 24 to 48 hours most of the time from the time the lab receives the sample to get the result. That's much better, but it's not as good as the second type of testing that we can do using the same principle, but having a machine in a local laboratory that can immediately process the sample after it is collected from a person. And that really makes a very big difference. As many of you know, we have ordered such a machine at the hospital. We've talked about this before, the BD Max. That's been on order for a month. We've had tremendous community support. And again, I want to thank the commissioners for the support that they've provided to help defer the cost of this machine. And yet we are still waiting for that machine to be allocated by the manufacturer. The machines are in short supply. There are many, many places across the country and around the world that want these machines, and we don't have it yet. When we do have it, we can run the samples in our lab and have a result within 2 to 3 hours. We can do as many as 24 tests in a batch, so we could do a lot of tests all at once. And hopefully, we will have enough of the reagents or the test kits to be able to run a good number of tests. That really helps because when someone comes in with symptoms or is in another situation, often with symptoms, occasionally we don't require the symptoms, we'll know right away whether or not the person has COVID-19 disease, and we can immediately act on that. Particularly in the case of the community illness, it's a matter of saying, okay, you've got this, who have you been in contact with? Let's get you home in quarantine if you haven't been doing that already. Let's identify if any of the other people that you've been in contact with have been ill. And it really makes a big difference to be able to promptly get on that. It's the same type of thing that we do right now with the flu. Same type of thing that we do right now with the flu. When you go into the emergency room or into your doctor's office during the flu season in the winter and have a fever and a cough, and we're not thinking about COVID-19, that was before COVID-19 became a part of the problem here, we had plenty of flu tests, and they would do a nasal swab, and in 20 or 30 minutes you'd know whether or not you had the flu, and then we could determine what the appropriate treatment was based on that. And that's the same thing that we need for the COVID-19. The Colorado Department of Public Health and Environment did provide us with a rapid analyzer. It's made by a company called Abbott. And we do have that operational in our laboratory right now. But unfortunately, so far, we only have, I think now we're down to 28 or 29 tests. They only supplied us with about 3 dozen. We had to use a few of those to make sure that the machine was working properly. And so then we I think that we had 30 tests after that, and I think we've used 1 or 2 of those. So that would be helpful, but if we started having a number of symptomatic people, for instance, in a restaurant, somebody comes in and says, got the fever, I've got the cough, we do the COVID-19 test, it would be nice to know right away if they had COVID-19 disease, and then we could say, okay, 2 days ago you were at this restaurant, you had dinner with 3 or 4 of your friends, are they sick? Let's kind of trace them. If any of them are symptomatic, we test them. I mean, it really, really makes a big difference to be quickly able to manage this disease. The rapid testing is a big part of reopening things that might have a higher risk of communicating the disease to another person. So we're hoping, as I said just before the meeting started, the company keeps telling us that we're almost going to get this machine for you. It should be here in a week. You know, we've heard that now for 2 or 3 weeks, and you know, there's just no assurance, in spite of all of the efforts that everyone has made to try to let the company know how urgent it is for us to have this. We just don't know. Is that going to be here and operational next week? Is it going to be a couple weeks? Could it be longer? Unfortunately, the company just won't give us that information at this point.
So I have a question for you, Doc. So approximately 29 tests or 30 tests is what we have for the Abbott machine right now. How many tests have been ordered for that Abbott machine, and when will those get here, and not just the test for the BD Max? What's the answer? Where's that lie?
Well, those tests are also in short supply. And when we were provided that machine by the state, they let it be known that there was not a big supply of those tests. And they were sending us 3 dozen tests to start with and hoping to have more for us. Bobby Locke has put in another order for more tests. And Bobby, what did they tell you?
So just today, they released a new system so that we don't order tests through WebEOC. We order them directly from CDPHE. So I submitted a request today for more of those Abbott test kits for this machine, because that machine we actually had to order it through our health department, because we're partnering with the hospital to get that machine. So,
but how many tests were ordered, and how many are they going to allocate to us?
I can't answer that because it was a request form.
Okay.
And you can only request up to 5 days worth of supplies. And I said that we tested 30 tests a day. So 30 times 5 is hopefully what we'll get. I have no idea. But I put the request in, and somebody was supposed to call me back today, but I have not heard.
And Mr. Candelaria, let me also clarify that our lab director has contacted Abbott directly.
Correct,
Oh, yeah.
which brings me to my concern and my point. We're in Southwest Colorado, we are not in the Front Range, and we are going to get swept under the rug and get sent down to New Mexico like always. So it could be, they could say you're not going to get tests for your Abbott machine for another 4 weeks because we need them in Fort Collins or Denver, and
Well,
they
not
don't.
everyone got the Abbott machines, though.
Okay.
They reached out
But
to
then why are
certain-
they not answering our questions of how many are they going to allocate to us? Just give us a number. Be honest with us. Be realistic with us. And I don't see that. We're not getting that. The state says that they are supporting us, but every email that I read, everything is a bunch of fluff. And at some point in time, if we are going to lock everything down and never move forward because we're waiting on this test, it could be another 3 months or 5 months. Nobody will answer the question. So
I've got one more fundamental question that ties into that. How long have we had the Abbott machine and the 36 tests that came with it? When was that delivered
week
here?
ago.
About a week ago.
A week.
You've only had that for a week.
Yeah.
So you've used 2 or 3 to test the machine and calibrate the machine to make sure it's reading right.
5.
We use 6 to
Use
calibrate.
5, so that leaves 31, and you've got 29 left?
We have used a couple on patients that we needed to test who were sick and
Okay.
at the hospital.
All right, gotcha. So we've used two of the tests on actual clients in a week's period of time. So if we extrapolate that on out, we've got, with 28 left, we've got 14 weeks worth of tests out there in the hospital right now, rapid testing capability right now.
Well,
If we stay at the same rate of test usage that we're using, we've
But-
got plenty. We've got 14 weeks worth.
But we're being very limited on what we use that for because we
But
don't know.
we're limited on the number of cases,
Absolutely.
aren't we, Tony?
Absolutely.
I mean, come on, let's get real. We're limited on both sides.
And that's
We're
the
limited
issue. Yeah,
right.
absolutely, right.
So I'm going to jump back, sorry, Commissioner, to where I was at. So we obviously still don't have an absolute on the BD Max, and I get it because they're probably trying to mass produce those. But there again, I know I've read those emails, and they keep saying it's coming, but you know the 3 biggest lies known to man, and that's one of them. So I don't have a real warm, fuzzy feeling about that. And at some point in time, we can't. I get the importance of the testing. I really do. But what I'm seeing on the back side of that is that the picking and choosing of what's critical, what's essential, and it's creating a lot of anxiety and almost pandemonium out there that we're going to start having to deal with on the back side of this, and it's going to be equal or worse than trying to live with this fear of being infected. So at what time, I mean, in your guys' opinion, and I don't know if you can answer it, but when do we move? I mean, if we can agree on this still has to go to CDPHE. We're probably, you know how quick they move. You know, it could be another week and we could actually have those machines here. So if we keep waiting until we get the machine, we're just delayed. And I will guarantee you, Southwest Colorado, Southeast Colorado, they're not looking us. The population is from Pueblo to Fort Collins.
Well, I think we do need to move forward, and it seems to me that we are going to be starting to move forward. I mean, there are many things in the Department of Health order for reopening that are going to help us to move forward. And I think, you know, at some point we do need to see what's going to happen with, you know, the occurrence of cases in the community based on any reopening that occurs. I'm not opposed to starting to do things. I think we just need to be careful as we move forward.
I agree, responsible.
What we do, and you know how quickly we do it. And I think that the availability of rapid testing, if we started to have an increase in the number of cases suddenly, can keep that number of cases, or help us to keep that number of cases from accelerating to the point where we have to say, hey, we're going to need to pull back here or we have a problem. I mean, you know, the example of the controlled burn in the forest.
Mm-hmm.
You know, you're going to light a fire, and I don't mean that in a negative thing. I mean, you know, lighting the fire is starting to let the economy open more. And as a result, we're going to see some increase in cases. And we understand that, and we accept that. And as long as that stays in a controlled fashion, then that's part of getting through what we're all suffering from here in this pandemic.
Right. So
it's just, you know, how can we best manage it if the flames start to flare up a bit? And the rapid testing is a really important tool for that. It doesn't mean that we have to have 1,000 rapid tests before we can open. It just means that the better our resource is, and 28 tests, if we start to see a bunch of cases, is not a lot of tests. We can go through that pretty fast. You know, that's what we need to look at. How can we keep this under control, maintain the confidence that the people have in our ability to make these decisions, keep people from getting frightened that they can't go out to a restaurant that they thought they could go to because all of a sudden there's this big increase in cases that we're having a hard time dealing with. You know, I mean, I'd like to see us have this going on. I just want us to be able to manage it.
So are you
Can I interject
comfortable with, let me finish first, Shaq.
Sure.
And this is maybe goes to you, Tony, or both maybe. What then are you, what is the number, knowing that we're probably at least a week and CDPHE probably a minimum of 2 weeks realistically? What is a comfortable number for you then to be able to move forward or to sign on to this to help to move this forward?
As far as the number of available tests,
Mhm.
I don't know that we've actually specified exactly what they'd be, but
And I don't think we can speculate. It
Yeah.
depends on how many. Cases start
Mhm.
to occur. I mean, I'd feel better if we knew that we had an open supply chain. if we only had 30 tests and we knew that we could get 30 or 50 more,
That's probably the more critical point. If we know that we can, yes, we only got 50 today, but we know in a week we're going to get 50 more, or we know there's that ongoing supply chain
So
that we
back to
don't
my
know yet.
original point
Mhm.
is, nobody's telling me that they're giving me an answer. Are
Oh,
they telling
us
you
either.
guys?
No,
yeah,
No, they're not.
telling us
So
either, and-
that's my point, is
Right.
and, you
we,
know,
we may be holding the bag for a year.
Well, I don't think we are. I mean, I think Tony and I could probably agree that we're going to get this machine sooner rather than later. But to be able to say that we're going to have it a week or two from now is hard. To be able to say we're going to have it within the next 4 to 6 weeks, I'd be amazed if we didn't have it by then.
Okay.
I think that's
So
true.
let's just use that, and we don't know, and I
Mhm.
understand you guys can't answer that, but with the education that's been done and completed out there, and what hopefully we will progress with and move forward with on some of the plans that the business owners have supplied on their own, don't you think that also calms that fire, it calms the storm?
Of
So-
course, it's part of the plan. Yes.
Correct. So our everything changes. Our environment changes daily. As it starts to get hotter, the fire is going to burn more rapidly.
Right.
As the night cools, which is now, we're going into restaurants, we're washing our hands before we go in, somebody opens the door, and that's just one example. I mean, at some level, not knowing when this testing is going to become available, we have to be able to move forward. So I'm going to use this. We have some businesses out there, they can only hold their breath for 2 minutes. Some can make it for 4. Well, after 6, they're clinically dead, correct? Well, some of them are approaching 4 minutes right now.
I realize
So,
that. That's
I
why
guess-
I want to see us start to do something here.
So what is, I mean, looking at the beds, and you guys can, I mean, maybe I'm getting
Can
way
I
off
just
board here,
add
but.
something? And I just wanted to let you know because we've spent the last 2 days dissecting that 34-page so that it makes sense for each section. Because we don't want to hand that page out to somebody, the whole thing, you know, we want it to be relatable to them. And we just shared that out. What I did was I went back and I made sure it matched the 34 pages to the best of my ability. So we've
And that's the new public health order.
right,
Okay.
and we have adjusted it a little bit because there are some hard and fast things in there. But to demand somebody to get surgical masks right now, we can't even get surgical masks.
And that's, there again is
So
my
again,
point. We can't get some of the stuff.
We are doing this. We have talked to over 50 businesses in the last 2 days and having one-on-one conversations with them and then turning around and sending out a form, the piece of that pie that fits to them. And that's not even counting the retail food establishments that Melissa has reached out to. Currently, I think 30 of them are closed.
Correct.
All the other ones are open, so we're keeping in contact, and I think, you know, right now, we are moving forward a little bit, and we'll be able to see what the effects of that is, you know, but I just wanted to add that. I think we are moving forward, and I think baby steps.
I think Shaq had a point that you wanted to make, or?
Well, I was gonna say, we don't need to necessarily not move forward with submitting a plan to CDPHE because we don't have X or we don't have this. We approve things all the time that are contingent upon. We could submit a plan
Correct.
asking them to approve contingent upon this MB Max analyzer showing up. We could still move forward submitting the plan.
And or maybe even more tests that you had requested from the state. If we get the 150 that you requested, I mean, that plus the 20 whatever, that gives us quite a few tests. So that's over 1% of our population within the county. I mean, is that? And then there again, also too, I realize that we have to look at your beds and the number of people that you can actually service if this thing starts to burn out of control. So I agree with Shaq. Can we contingent upon that and maybe
I would
getting
disagree with the contingents, and I'll tell you why. Saguache County, Mineral County, and there's more out there that are submitting in early open plans without that contingency, and they're using the square miles of their county and the population. So this county is 2,040 square miles. And they feel if we're talking about the number one thing is spacing, social distancing, then they by far meet that criteria, and they don't want it to be contingent on the rapid testing. First of all, they haven't ordered, and they don't have the capability to get the machine that we're getting. So I don't think we should make it a contingency.
Excuse me, sir, to elaborate on that, I think there are other things on this agenda that can help to give us the whole
Okay.
picture here.
Well, then,
You know, so
Well,
we'll move right on there.
I
Yeah.
think we ought to move past the idea of testing
Okay.
for the moment and talk about some of these other things, because I think when we look at the whole thing about the physical distancing and compliance with those aspects of that, it can make a difference.
All right, let's
One-
do that then.
Yeah,
Oh,
one
yes,
other
sir.
question I'd like to ask this to Tony. Of the 11, at one time, and I don't think it's changed, there were 11 people that had recovered from COVID-19 in our county out of the 15 cases that had been reported at that time. I think 11 of those had been recovered or were no longer being treated. Is that correct?
That's correct.
Were any of those people hospitalized? Were any of those people in your hospital to be treated for COVID?
Yes.
How many?
Actually, I'll be honest with you, this
Yeah.
has been our most active week. So the timing of this discussion is a
Okay.
little bit unusual because we do have patients hospitalized right
How
now.
many do you have right now?
3 this morning,
Three.
I believe.
Three
Yeah.
is this morning. We
Yeah.
had one who was in a few weeks ago and has recovered. The three now, we would expect them to recover, but they're not recovered.
They're not on ventilators or in ICU?
No.
Okay, all right.
Of course, we had
No, they are in ICU.
Right, but those
Yeah.
never reached the hospital, I
One
don't
of them
think.
did.
One did, but one didn't. So basically, where you're at, Tony, as far as your capacity of 45 beds that you said you had available without going
Mhm.
to extra leaps and bounds, 5 ICU beds, is that correct?
4.
4 ICU beds and 45 regular med-surg
Mhm.
beds? We're not even, we haven't even scratched the surface of that.
No, and
Haven't
hopefully
even-
we wouldn't because it's, like I said, there's 4 ICU beds and the COVID
Right.
patients typically are going to require that level of intensity. So we don't have a lot of room. I mean, I think we also have negative pressure rooms that we can move to. We actually could move to a COVID unit if we needed to,
Right.
but the requirements of those particular patients are much greater than the general. They
but
can't
so-
put those in all 45 of those beds.
But so far, none of them have been to ICU yet.
No, but I can tell you, we were sweating a little bit this morning because of what's happening this week, yes.
All right, well, let's move forward. Let's go to, on the agenda, the county administrator, discussing why we're shooting for the 40% of occupancy of the restaurants and gyms, while the rest of the state is leaving them closed and or restricting to 10 or less. You have the floor.
So the reason that Montezuma County is pursuing an occupancy of 40%, and I understand that's against the governor's current order, but he allows us to appeal for an exemption. And if it was allowed under the current order, we wouldn't need an exemption. But the whole point is, in speech after speech, he said during this phase, we want to reduce social interaction by 60%. Ergo, if we allow businesses to operate at 40% of their capacity, we've cut out the 60% that he wants to reduce. So I think that we can petition the state and ask for 40% of a building's occupancy, requiring the 6-foot distancing within that 40%, and still hit what is the spirit of the goal, which is to reduce interactions by 60%. And so that's why in this plan that we're outlining, we're asking for a 40% occupancy instead of keeping buildings closed. If we say 10 or fewer, I feel like that's just an arbitrary number. If you take, for example, and I don't want to pick on anybody, but if you were to take Pippo's or the Depot in Dolores, 10 people comes a lot closer to filling that than, say, the Lots of Pasta building. 10 people wouldn't come anywhere near filling that, and they'd be 15, 20 feet apart. So my recommendation is, if the goal is to reduce by 60%, then allow us, please, to use the 40% that's left.
Any discussion about that?
Would that be agreeable?
Is that a fair
Yeah,
ask? I
somebody,
mean, is that a fair ask to,
No, I think it is. I mean, that's within the spirit of the guidelines.
yeah,
So what we're going for.
yeah.
I think, and am I wrong in that we've seen guidance where supposedly, and again, we're waiting, we're at the mercy of the state, but supposedly by the 15th, they were looking to 50% occupancy of restaurants. And I swear I saw that somewhere. I haven't been able to focus on that because we're focusing on this, but.
There
My
is a,
understanding was that they were looking at 50% occupancy of office buildings.
Yeah, I think you're right.
I think it was something about restaurants coming on the 15th. But again, we are waiting. So.
Well, that's their regular opening date for the restaurants.
For the restaurants.
Yeah, but we're asking for an exemption so we can open sooner.
and a lot of it is really because of geographically where we live in relationship to the rest of the population. And we're not affected the way they are. Our numbers in this county are not affected as they are in Denver or Aurora or Douglas County or any of those. So if you guys are good with that, we can move on to the next one. 40%, you guys are good with that, so everybody would.
Yeah, let's go to, on the agenda, it's the county commissioners' discussion of impacted business. I think Commissioner Candelaria brought up an example about being out air at 6%, but does the commissioners have anything to say about that?
I'll keep going. I looked at, I don't want to take up all the time, but go ahead. Sir.
I'll talk about two, and they'll remain anonymous, but one is a business owned by a woman, a lady who employed, I think at her normal business, she had approximately 6 employees that were there full-time every day of the week. When the shutdown came and she had to let those staff people go, and they went and applied for unemployment and payroll benefit, whatever benefits they were able to apply for. She's down to running the business by herself as best she can. She's contacted all of her previous employees and told them, if and when I'm able to reopen the business and start getting back and business come back, you want to come back to work? And 3 of the 5 said, no, we're making more money. We're making more money sitting at home than I made working for you. So I'm going to tell you, business is going to have a dickens of a time encouraging people to come back to their jobs because they can lay in their house and make more money from unemployment and enhanced $600 a week or whatever. Unemployment, $1,200 from the federal government. I don't know how much more. They're making more money staying at home than they are at their jobs. So I'm going to tell you, even if we said, you know what, we're going to open up every business in Montezuma County, there's going to be a lot of them aren't going to be able to open up because a lot of the employees aren't going to come back.
And Commissioner, I'd like to add to that some of these businesses that have applied for the PPP loans, that one of the conditions is that they keep a full payroll staff, and they have to do that for 8 weeks. And how are they going to do that when they're not serving them?
It's a possibility. They're setting them up to fail. It's a setup to fail. It's a setup to fail, and they're failing. And the businesses are failing. And I'm going to tell you, they're going to go away. If we keep dragging this on, this community is going to see, they're talking about 40% of the oil companies that are in business today because of the Russia-Saudi Arabia battle over oil. They said 40% of the oil companies in America today are going to be gone by the end of this year. I here to tell you, I'll bet you 40% of the businesses that are in this community in Montezuma County will be gone if we take this thing another month or 2. They will be gone.
So I'm going to shift gears a little bit, and this will go kind of back to you, Tony or Kent. So one of the questions that we're asked is I agree that we have the capacity, but there needs to be a trigger point, which actually I'm going to say I agree with that. But the trigger point, as far as the beds that are then occupied, would be kind of that trigger point. Do you agree or disagree with that?
Actually, we took a little different approach because I asked my team to come up with an approach on what we would do on that. And it relates more to not necessarily, like I said, because you're looking at a really small number if you're looking at just our beds. So we actually, and I believe what you all talked about was on the number, or seeing the trend, was basically, if you want to.
50% increase in the number of cases over 2 weeks.
Right, right.
So if we had 5 new cases, if we had 5 new cases this week, and 2 weeks from now, when we had 10 new cases, that would be a 50% increase in cases over 2 weeks.
5 to 10 would be 100%.
100%
right?
increase.
Yeah, so I guess that's 7.
But I mean, so what would you guys be comfortable with signing on to this? I mean, because that trigger point, I think, obviously, we're watching our fire burn.
Right.
As long as it's smoldering, burning downhill, I think it's good. But at some point in time, the conditions could change and it could flare up, but it could just be a spot fire too. So I guess that's what I'm asking for your guidance is.
And that's basically, we were looking at a rolling 14-day period, right? So that way, we'd take that into consideration, that if you had those cases starting to drop off, that is going to show you a true trend, that you're actually seeing that flare up and it's holding. It's not just a one-time thing.
So is it actually 50% or 100%?
50% was, I think, the number we came up with.
Okay,
Yeah.
okay.
So that would, if we had one case, 2.
Well, if it was 50%, it would be decreasing over
But you're looking over the 14-day period, right?
Right.
Yeah,
Right.
okay, so you're looking at the
Right.
span of it for the 50% increase. So
Right.
right now, watching it, we don't have that, correct?
Well, actually, this week, we would have actually hit that. We have seen that much of an increase this week.
So one thing I'd like to say about, from a public health perspective, we're looking at the hospital and their capacity, but with that, you have additional contact tracing. With that, you have additional positives.
Right.
With that, we're tipping the hospital even further. So, looking at it from a preventative concept, which is really what this is. This is a public health emergency. This isn't necessarily a medical emergency. It's a public health emergency that we're dealing with. So looking at it from that perspective, I think, your trigger point at the hospital might even need to be a little less, because you have to anticipate that we've now opened up restaurants, for instance, which are one of the highest, and I'm using it for instance, if we do that, that's one of the most contagious spots that you can get this from.
Right.
Because people are socializing, sitting, talking, masks off, that even if you socially distance, you still have a greater risk. So, I think we have to keep that into the mix, that you kind of on a prevention mode too, so you have to have that wiggle room for those increased cases that we are going to get, and some of those, not all of them, but some of them are going to be sick enough to be hospitalized.
Right. And that's one of the things in my response, it actually kind of all ties together, because if you have more testing, you're going to get more positive, which is going to put more workload on your department, which one of the things that we want to see is make sure you have the ability to handle that, because identifying somebody as positive is one thing, but making sure you've got that complete tracing in place is going to be a big part of that whole link.
But you're talking prevention. So prevention is different. Prevention is what we can start tomorrow with continuing the message of proper hand washing, proper sanitization.
We started it a month and a half ago.
I understand that, so that's been going.
Yeah.
So it's just like the fire prevention. When fire prevention started, before it started, there were a great amount of fires. And now it's taught everywhere, which is what we're doing. So prevention as far as fires, it's almost non-existent anymore, which is what we're trying to do. So the prevention part of it is we're educating our public.
Absolutely.
We're only asking for 40%, so we're not obviously getting way out there and being irresponsible.
But so I look at the public health order that's out there now, and we are at a point right now where retail stores can do curbside. So that was the kind of the little the baby steps in the right direction, right? So that's going on right now. Friday, retail now opens up to people can go in their store, because the retailers are supposed to have that planned out of how they can maneuver the store and keep all the social distancing and the masking and cleaning the facility, 10 or less in your facility. So we're doing all the right things and moving in the right direction. My concern, and I think it's everybody's concern, is that when we open this too soon, then we will, like Tony said, you're going to have, it stands to reason, and when we get the BD Max, there's going to be way more testing, and we want way more testing, but with way more testing comes more positives, just the ratio, and with more positives, you have more contact tracing, and we're going to be picking up additional positives with that. So So, but then you have the component of sitting down in a restaurant. Now we've got, okay, all those people, because we don't have that right now. We don't have to deal with people sitting in a restaurant being exposed within 6 feet.
And
No, they're at Walmart, and they're at IFA, and they're at Big R, and there's, we already have that. We've never stopped having that.
But we are handling it though, with where we are right now.
But it's not what you
No, we're
said it is,
condensing
Bobby.
it.
It's
We're not spreading
this
it out.
number in the store and this distancing and all of that. I've been in too many of them. It's people in there shopping just like it was back in November.
Well, and that's
So-
part of the problem too. We were under.
But
we were
the
under
problem
stay
hasn't
home,
been
so-
produced us any more illness. If that's the problem, why is the number not 39, 40, 50, 70 going on 80? Why are we not seeing
Because
the
of
boom?
community's involvement, we have a lot of people who are doing what are being asked of them. We really do. I mean.
and we're
so-
asking the same. We're being responsible.
Well, I would like to rephrase
With
that
the
question
40%.
because we're not telling them what to do.
No,
First of
no,
all,
I said we're
they,
asking. I didn't say telling.
well, you
I
said
yes.
what's being asked of them. So
Yes.
the topic was a discussion about impacted businesses. Our phones ring off the hook with the different businesses in this community, and the stories they tell us about washing their walls down with Clorox, the precautions that they have went to make their store safe, so that they can open them back up. And they didn't need a 34-page health order to do that. They're doing that on their own.
Well, we've been educating them for a month and a half.
They've been educating themselves. They're just as smart as us or smarter.
So if you guys are good with that, I'm going to move on to your next bullet point, Tony. that you-
Well, I want, but we made one about the 50% because I have a problem with the 50%, and that is this. I did the numbers of 28,000 people that live in this community, and that is 0.006. So a pandemic means that is not even close to 1%. That is, and we're saying that if we get if we got 4 in 14 days, if we have 8, that we would take precautions, we would close the businesses back down because we have 8, which still would not bring 1% in this community. So I think we should use a number of how many people live in this community to come up to a conclusion of when we should start scaling back. Instead of a 50% for 1 would be 2, 2 would be 4. Well, that's not even hitting 1% of our total population.
Well,
There's way more people that come to this hospital than this community.
Well, they haven't been because they haven't been allowed to do elective
That is
surgeries
not-
and such
that-
and
no.
such.
That is not true.
So all of the nurses are working at the hospital right now that were working a month ago?
I'm talking.
Nobody's been laid off at the
I'm talking
hospital
about-
because of lack of work?
Nobody has been laid off at the hospital, no.
I think what she is saying, the people that are
She's saying-
serviced by the hospital.
Yeah.
So
Patients.
you're including Dolores County, which probably obviously is.
Well, that gives us a greater number.
It does,
does.
but there's a lot more people that we're servicing.
Well, they have 0 cases in Dolores County.
So I would like to interject with a thought here. Since we're discussing numbers of cases, we're averaging right now roughly 4 cases per week. And in order for this virus, we all agree, isn't going anywhere. It's here with us. And it, according to everything I've heard, stops being a danger when we reach herd immunity because 50% or more have had it or we have a vaccine. At the current rate of 4 a week, 4 times 52 is 208 people per year. It'll take 63 years to reach herd immunity. There is no way we can expect to leave the economy shut off for 63 years. But even if you had 100 cases a week, and you took that 14,000 people, which is half the county, and multiplied it by the 100 cases a week, which we all agree would be a disaster, that'd be 5,200. 14,000 divided by 5,200, you're still looking at 2.5 years to reach herd immunity. How do we keep dragging our feet and say that, I agree we've got to take precautions, but we can't leave everything shut off for 2.5 years while we wait. We aren't going to have an economy left to pick up at that.
I don't think anybody's advocating that. I mean, I'm not sure where we were going with that. I mean, we've agreed. I mean, I've said very much publicly, we need to start working towards getting it out, as long as we do it correctly. If we do it correctly, it can be done. But you can't jump into it, open the gates, and expect everything's going to be great, or we're all going to suffer for it.
And we're not asking that. We're not asking that in this plan at all.
Okay.
We are not asking that. We're asking to move forward with the plan. This thing may get denied, but if we don't have.
Could you speak into the mic? People are having trouble hearing you.
Well, I mean, I think that we're really more on the same page than we're giving ourselves credit for here, okay? I mean, you as the Board of County Commissioners all agreed to start with the governor's plan. And, you know, clearly, we're wanting to move beyond that, but I think we're all in favor of, number one, starting with the governor's plan. We're ready to do that. It's gonna happen over the course of the next few days, and that's fine. The question is, where do we go beyond that, at what pace? It's not a question of do we go beyond that, it's what pace do we go beyond that at?
So would you be willing to negotiate for the 50%? I mean, it's a plan. If we don't get a plan submitted, we're under nothing.
No, I agree.
We've
I
done
agree,
nothing.
but I
So
just think that.
I guess I'm saying, and we can agree or disagree, but if we can at least agree to move this plan forward, if you're comfortable with the 50% as far as public health in the hospital.
Yeah, because I think there's something down on the list that would impact that decision, so I would
Okay.
agree with that.
Okay, so I'm gonna put that down as 50%,
Okay.
and that answers that question for you for that trigger point?
Yes.
Instead of
And I'm gonna-
40/50?
50%, and then I'm gonna turn the
50% of
page.
cases came in not business.
Okay, gotcha.
Go ahead, Dr. Aiken.
Yeah, if I could ask one more question about the impacted businesses. You know, you guys have a much better sense about the business in this community than I do, and, you know, again, I'm very much wanting to not see any of these businesses fail. I mean, you know that. Tell me, as we move forward with the governor's order, which businesses are we really leaving behind? We've got restaurants and we've got
Restaurants.
gyms as two things look there. Are there other businesses that we need to be thinking about that we're leaving behind
Do you have that list?
as we move ahead?
Hospitality
I think there's a-
industry,
Yeah, we've got a
hotels.
list. He's got a list.
Okay.
Well, I've got it in my mind, so I'm just
Aren't
gonna
the
rattle
hotels
it
allowed
off.
to be open?
They're already allowed to be open.
Yeah, hotels are.
It just, you just can't
Hotels
use
are
the
allowed
pool.
to be open, but they don't have any business there.
Right, yeah, no.
Uh, VRBOs are largely impacted. Guiding services, outfitters, a lot of the tourist-based retail,
Banks,
all of these,
They can
banks,
do
most of the
curbside.
banks, or at least the banks that I attend, their lobby is closed. You basically have to call for an appointment. You have to go to the drive-up window. So you've got banking as, people that are trying to make loans, do financial, it's a very cumbersome, difficult deal to work with lending
Is
institutions.
that gonna change with the implementation of the,
so
safe at home?
I wasn't done yet. Dude ranches, and any outdoor promoter activities, racetracks, all of those things are prevented by gathering sizes. So if we could say use 40% of the occupancy and enforce physical distancing, many more of those businesses could begin to function.
So
And-
would we be thinking that we would then say that a racetrack could open with 40% of the stand?
I think what we're saying, Doc, is that we're giving back people a choice. They may choose to not open because 40% may not give them enough to even open it, to function, to do what they need to do. But it's a start to give people back a choice, because right now they don't have a choice. And the Tri-City Chambers, when they did their survey, and I'm pretty sure the number she told me, and I'll have to check on this, but I think she said there are 700 businesses in this little area, which is a lot. Well, there are not 700 of those that are open. So I guess we give them back the choice to open when we move this plan forward. I don't want to say I left any business behind, because I don't think that shouldn't be my choice. It should be left up to them. So I don't like the analogy of, well, what are we going to leave behind? Well, if they're functioning as a business and it's a job and they're providing for their family, the word critical business it's critical to me because I need to work, or to that family, or to somebody else. So I don't want to leave anybody behind.
Right, and I
So-
don't mean that we're gonna abandon them. What I mean is which ones are not covered by what the governor's order allows, and which ones are we trying to help to have the opportunity to open by what we want to submit.
I think when we do this, it's 40% to the businesses.
All of them.
Right.
And then it's based on their occupancy load. So, obviously,
And the fire marshal can give every business that occupancy maximum.
well, they already have
I
it.
spoke to a gym owner today. I asked the owner, I said, could you stay feasible, could you stay viable if you were allowed to have 40% of what your building occupancy states according to the fire marshal? And they said, yes, we could. It wouldn't be great, but it would make them viable. And they can do the spacing, they can do the distancing with their machinery and all that stuff in there. And, you know, we've got to give these people a chance to abide by some of the regulations, some of the requirements, and give them a chance to survive. 'Cause I'll tell you, there'll be a day where they'll walk away. They'll walk away from the loan, they'll walk away from the building, they'll walk away from the business, and they'll walk away from the property tax, they'll walk away from everything.
But we also have an obligation to help them to understand what the risks are of doing certain things. And like a gym, I don't have a problem with the gym that follows these guidelines.
I think, and I think they would be more than absolutely willing to follow whatever guidelines Bobby or the governor or whoever says, if you will do this, we'll allow you to open your business at this level. I think they're dying to be able to do that.
Right, and there are certain businesses that by their very nature promote a sense of gathering that might be greater than the sense of gathering that we have when we go to the Walmart or when we go to the Big R or go to the IFA. And so those are the ones that we need to be sure that we're really ready to help open spaces.
Yeah, I think that's that's a huge step from where we are to promoting mass gatherings, beyond where, I'm not even sure that's going to be in the governor's phase 2 part of that. And I think you're probably much less likely to get a plan approved if you're taking that big of a step right at the first.
And we're not asking for
Mass gatherings.
For mass
No.
gathering. I think
You were talking about a racetrack and things like that where you're going to have
Well,
several hundred people in the stands.
I think that was under sporting events is
Okay.
where they classified it or categorized it. And I don't think we have sporting events here other than
Okay.
the high school sporting events or we don't have professional football, baseball.
No, well, we
don't
do have
those
rodeos
kind
and
of-
stuff like that.
The rodeo's already been postponed, so that would come to a consideration later, hopefully in phase 2. But to move it forward, I'm going to move to page 5, if that's okay with you, sir.
Sure.
Um,
Is that on the agenda? Is that what you're talking about?
Well,
Or-
I wanted to hit Tony's points that he had really addressed because,
Well, while you're
that
looking for
way-
that, I want to tell a story. I went to Pizza Hut last night at 5 o'clock to order a pizza through the drive-thru. Gentleman drives up in a white Dodge pickup, 4-door, got a couple flags on the back, jumps out in a pair of steel-toed boots. That man doesn't deliver pizzas for a living. That man is out of work. He either is a welder or works in the oil field. But he was driving that Dodge diesel pickup so that he could provide for his family. 5 minutes later, the next guy drives up and gets out there to go get the pizza, deliver him steel-toed boots. These people are doing whatever they can to take care of their family. And as government, we should give them every opportunity to do so, to get back to work. And as far as the racetrack, what they asked us on the racetrack is they said, we would race, we just want to race without even, if there was any even fans to start with.
Yeah, I heard that. That's-
I wouldn't have a problem with the racetrack operating.
Mhm.
I do have a problem with people starting to congregate in the stands at this point.
Well, and they're not requesting that at
Yeah,
this
if they want to
time.
get out there and race, I don't see that as a big deal. I see the people congregating in the stands. I mean, we've all been to these races and we know
but then
what
that's
it's like,
considered
and
a sporting event. So if we're going to put that in the
Yeah,
plan, we
right,
need to put it
okay,
in the
so
plan.
I'm just
So-
trying to clarify clarify that, you know, there are things here that I think we could be talking about that, you know, we're all in agreement on
Okay.
doing this. I mean, I'm in agreement getting the welder back to work if he's out of work, and, you know, that's really important, really important. It worries me what's gonna happen to the economy in this country if we don't get people back to work. I mean, seriously, it does. That's why I'm sitting here today
Okay.
to talk about this.
So on page 5, Tony, you're talking about a plan again, and as far as the increased capacity is needed, can you elaborate on that for me?
Let's see. Well, I think that refers back to the health department's ability to do contact tracing. Is what I was referring to there. Again, like I said, we know more tests are going to have more positives,
Sure.
going to require more contact tracing, and it's going to result in more positives, more tracing. So it's going, when it starts, it's going to be big, and I just want to make sure that they have the ability to do that, because that's a key component in the process.
It is the county's responsibility to ensure that they have the ability to do that. So during this time, if they need more nurses to help with that, then the county will get more nurses to help with that.
Right now, then, this was your comment, right, in red?
It was.
Yours were in
It was.
blue.
Can I just add to that, just a quick number? We've had the 16 cases so far. We have contacted 132 people from those 16 cases, and each of those contacts take different amount of time. You know, some people are dealing with housing issues, food insecurity issues, you know, lots of questions. Some of them, you know, some of these people are in different counties, different states. So it takes a lot of time to do that. So I appreciate that comment, because I'm looking at, you know, we're not.
But that is something that we can resolve,
Right.
hopefully, too, by if something happens, then we obviously know that we would have to provide more staffing.
We appreciate that.
And
Trained
the county would
staffing.
have to pay for it.
Correct, I understand that.
The other thing I would like to say in regards to the more we open up is that, you know, we would continue to do our education, because education is way better than coming down on people for not
Absolutely.
doing something
Prevention.
right. Yes. So, but we still have to have the ability to enforce and guide people to do the right thing once they open up. So enforcement is something we absolutely have to have capacity to do, and I would tell you, we do not have the capacity to enforce.
Well, that's actually the next agenda
Oh, is
item,
it?
which
I think, yeah, I'm going to
Okay.
6.
Sorry.
that's concerns about enforcement, and then the health department, or the hospital was the first one on the list. We can just go down the list. Do you have any comments about enforcement?
Yeah, I think that's a very much, as Bobby was saying, a critical component to this, because unfortunately, you will have and have had businesses that basically don't feel the need to abide by the requirements and have basically just blown them off. And that opens up, that's a break in this whole process that we're doing. I mean, we agree that this can be done under these guidelines as long as people are compliant. If they're not, there has to be some ramifications for that. I mean, we can't just allow it to happen. And like I said, I've seen it. As late as today, I saw a Facebook post where one business said didn't care what was said, they weren't going to comply. They were going to do what they wanted to. And if that attitude's allowed to continue, then this is not going to work. I mean, and it's going to affect everybody. If you get back to the situation where we're shutting down, then one business has potential to shut down the whole county.
So what's your recommendation for enforcement? How would you?
The health department has the ability to ask for assistance in enforcing that. I mean, the local police department can get involved if they need to do that.
And we have. I
Yeah.
mean, you know, unfortunately, you know, our step as what we've been doing is we do what we can, we educate, we follow up on complaints, because that's kind of where we mostly get our radar goes off when we get the complaints. We contact the business, we ask them to comply. We get another complaint, we make a visit. But the point is that if they don't do, then we reach out to the DA, then we get Cortez PD if it's in the Cortez area, and they go with us, and we go in person with the police department, and we issue what we need to issue, and then there is a fine and potential jail time with it. So it is serious. The governor wants it enforced. He said it every time in his speech. We are directed from CDPHE that we must enforce this.
Actually, he said that everything that he's doing right now is not enforceable. The governor said in his speech that it was not enforceable. So I would like to ask the question of what the businesses are doing that they should be fined. And who came up with the fine number and who came up with the jail
That's in the
time?
public health order.
Okay, so how much is the fine?
$1,000.
And what would be the ramifications to be fined $1,000? What would be breaking the rules where they should be fined? Can
Well,
you give some examples?
I don't wanna single this particular incident out, so I'll go with, something that has come up recently, and that's not wearing facial masks, facial coverings. So, we have contacted the business, we have attempted to educate, we'll check in again and see where we are with it. So, because essential businesses that have employees are required to have masks on if they're dealing with the public. That is a law, the governor's order, it is in the governor's order.
What about a non-essential business?
Non-essential, at this point, I'd have to read the non-essential.
I know the
Everybody should be
answer.
wearing masks.
Huh?
Yeah,
I mean,
No, non-essential, his governor order says that it's optional.
if you're dealing with the public, they want you to wear a mask. The governor is encouraging Coloradans to wear masks, but that is not a law. I mean, the public has the option, but it is highly encouraged because, as we know, this is how it's spread, right? So, and the more we become more mobile and the more businesses we open up, the more greater likelihood of spread is going to happen. So, it's more to protect you as well as protecting the others. So, and it's not because we want to, we're not trying to be heavy-handed. We're really just trying to educate.
Go ahead, Dr. Aiken.
Well, speaking as part of the health department, I don't want to see anybody get fined.
No,
I mean, I don't like the
absolutely
stick
not.
approach
No.
to enforcement. I think that that's the wrong approach. It doesn't bond the community. It
No.
makes somebody seem like the bad person.
Mhm.
And I think, my experience has been leading by example. And if we're going to adopt a document that we're going to submit to the state for approval that talks about all of these guidelines of mask wearing and physical distancing, that we all need to buy into that. And we
Correct.
all need to say that this is really important. And we need to encourage the people in our communities to follow this. And that can be the best enforcement if we're all on that page.
And
I don't know how much difference it makes to wear a mask when I walk through the Walmart. I mean, I'll admit that. I know it makes a difference if I wear the right kind of a mask when I'm taking care of a COVID patient in the hospital. But we're trying to utilize the tools that we've been recommended to use until a better tool or better information comes along. And if we feel that it's important enough to put in this document that we all are going to sign off on, then we all need to actually believe in that. I mean, we know businesses that are not wanting to comply with this. My feeling is I'd go in and say, hey, you've got a great business here. I like shopping here. I'm not going to stop shopping here because you're not following this. But explain to me why you're not doing this. What is it that this means to you not to do it? And personal choice, I understand, but we also have a responsibility to our community. We're all sitting here because we feel that responsibility to our community. And we need to encourage that same sense of responsibility at a crisis time like this with those who lead our community, and many of the business people are major leaders of this community. So if we're all on the same page with the document that we sign, then let's all be on the same page about how we encourage people to comply with that document. And I think that'll take care of any need to worry about fining somebody.
So then we would need to agree on the critical and non-critical businesses, correct?
that's defined in the document.
But I believe the requirements are the same for both. Anybody that's
Dealing
and
with
contact
the
the public.
Yeah,
Yeah,
it's-
requirements are
You
the
don't have
same.
to wear it all day long when you go up there, and if you choose not to, you know, maybe you can work in the back room, you
Mhm.
know.
No, and I understand that. If you're working in a closed room, yeah, obviously you're not going to
Yeah,
wear
it's
your
not-
mask. Just, I get that, but I think what you're, and maybe I heard this wrong, but you're saying we should be wearing them all of the time, and that's what we sign off on, or?
Well, whenever you're in a situation where you might be spreading the virus to other people, it really protects the people that you're coming in contact with if you happen to be having the virus. I mean, me wearing this mask keeps my droplets from spewing out when I'm talking. It doesn't really protect me that much from somebody that I'm sitting by whose droplets are coming towards me. Now, I have a little better quality mask, but still, you know, we have an even higher quality mask for our COVID patient management at the hospital.
Right, which is what we're in
Right.
short supply of, and we're not going to use
But it's-
those for the average person out there,
It's
so.
just that, you know, in the circumstances where you're coming into contact with people, at this point, it seems to be appropriate to be wearing a mask. And we may find out a month, 2 months, 6 months from now that it really didn't make that much difference. But it's the spirit of the community, the spirit of trying to keep this thing under control without imposing, you know, really tight restrictions like we've had to go through in the last month or so, that we want to try to foster. And from the standpoint of the VRBOs and the hotels and the outfitters and people like that, we want people outside of Montezuma County to say, look how successful they've been in keeping this thing under control and easing the restrictions and opening up to having people from the outside, which we so much depend on. It's going to take a little while for that word to get out there, for people to understand that, hey, this is actually a pretty safe place to come. And it's a safe place to come because our community has this unified spirit. And I think we're seeing that already. I mean, you look at the survey that was done that we all looked at last week, you know, I mean, I think really most people in the community have been compliant with it. And I totally get the part about I'm an individual and I want to be able to do this. You know, we all feel that way to some extent. But we also have a community responsibility.
So, I guess, did you see what critical and non-critical said as far as the,
It's the same. Critical and non-critical are the same requirements.
okay, so
in the
you would
public
be,
health order.
you would be comfortable, and you'd be comfortable with that? As that?
Right, I think,
40%.
yeah, on page 5, you've actually listed the requirements, and which are very solid. I mean, I think that's what we really are looking for. It's just, again, we want to make sure everyone understands that this isn't optional. If you open up your business to the public, this is what you have to do.
So I disagree with the way that you said that we all got to fall in line. Somebody needs to protect the people that don't think you should wear a mask, and I'm going to be that guy. And I can tell you, as far as the fines, as a county commissioner, when we have somebody that is going to die in 6 minutes without a breath, and they're sitting there on 4 minutes, they don't have the $1,000. They might not have a mask. I would not be willing to enforce fining them on 3 tries, maybe 5 times, 6 times. I don't know what that number would be, but I think the masks are absolutely ridiculous as far as you ask me. I've heard of people getting rush, where you, and you know, you're familiar with rush by the bacteria by having a mask on for 12 hours. And the reason they got the mask on for 12 hours is I've talked to doctors where they said they might change their gloves and they might change their mask in one procedure 4 or 5 times so that they keep the bacteria, which you would know what I'm talking about. Well, we have a shortage of masks, and so we're going to cause. I've heard a story about a 28-year-old girl that actually had an N95 mask on and driving down the road, hyperventilated, passed out because those masks are so good, and ended up having a wreck. As far as the testing, the testing, There's another way to look at the testing, and that would be this. I go get tested and I'm negative. The first thing I do, it took I have been so concerned, I've been so careful to not get anybody sick. But now that I just seen the tested that I was negative, I go down 5 minutes, somebody touches me and I got COVID-19 and I don't know it. Because I have such confidence that I have that negative test, now all of a sudden, in the next 3 days, I'm going around seeing my friends I haven't seen in 2 months, and I have just infected 20 or 30 people. So there's two sides to the coin, and I would not be for enforcing. There's some counties that are looking the other way, and I think the masks are ridiculous.
I'm going to be flat out honest with you. There's no way I'm supporting moving anything forward if we have this type of attitude in this county. If we have one of our leaders in the county basically telling people, it doesn't matter what you do.
So you're a leader in this county, you make $350,000 a year.
No, I don't.
You don't? How much you make then?
It's none of your business.
Yeah, it is.
If you want to go through my board and
Yeah.
find that out, we'll be glad. I'm not discussing my salary in this
Yeah,
agreement.
well, I know what you make, and I can tell you the other thing as an elected official, you're not an elected official. You have no authority to go to one of these businesses and harass the hell out of them, as far as I am concerned.
As a person.
And I can tell you the other thing, what you're going to do if you're not willing to look at this plan.
I'm very willing to look at this plan.
No, but if you're not willing to move forward and compromise, I can tell you one thing. The banks that paid you a lot of money, these local banks, they also have loans to all those businesses. And I wonder what the presidents of all those banks think if you are going to try to destroy this community because you're not willing to.
Destroy the community.
Yeah, you
Yes,
are.
me, you are.
No, you are.
If you're taking that attitude and you don't care about the health of this
No,
community,
you have got this power to struggle.
No, I
with
don't.
it. Yeah, you do.
we have a plan very logically that could be laid out.
You're not logical. I seen the video of how logical you was and how up in the face you was of that person.
And just, we're way into the weeds, guys, so this is something that has to get submitted to CDPHE, and I think that's what our focus needs to be. Let's try to get something submitted. And I guess this is a negotiating point. I am willing to wear a mask or ask businesses to wear a mask. I realize that it's not optimum in any means. And we definitely are, I don't like them either, but if it allows them to go to work, to be able to provide for their families, then at some point we have to negotiate to move it forward. And I think what you're asking is that the masks are worn. That is part of the PHO, and I guess I need.
Well, there's another way we can do a safer at work like Will County and the three commissioners. We're the Board of Health. Let's get this straight, ladies and gentlemen that's watching in TV land. The three commissioners are the Board of Health, period. We're the ones that make the vote whether we go forward or not. The way that the governor wrote this is that the hospital and the health department have to sign off on it, but we don't have to do that. There is another option. And the harassment of a business that's been in existence for 70 years, how long have you lived here, is uncalled for.
I haven't harassed anyone.
Yeah, you did harass.
No, I did not. I asked the manager of
I
why they were not complying. I was told to leave the store.
You're
I
making
didn't like it.
$350,000.
I'm not making
Why don't you, is the hospital been making any money? Why don't you lower your salary and help pay those businesses so they can get open up?
So
Huh?
I'm going to jump back.
Did you ever ask the board for another $100,000 raise 2 or 3 months ago?
I didn't know we were here to discuss my salary.
It can just be a facial covering. It does not have to be.
It does not have to be a mask, no.
It can be your T-shirt wrapped around. It's just a facial covering. So we keep saying masks, but it honestly can be just a facial covering.
It can be like, some
Okay.
people wear bandanas. I've seen
Exactly.
bandanas. and
I
stuff.
think that
If this is a
that's
deal
the
breaker,
delineation
It does not
of
have
that.
to
Yeah,
say
So-
masks.
I think we've got to get back to, if some kind of facial covering so that one person's
Let me,
droplet.
it's not just the mask. It's
Okay.
the attitude.
Well,
I mean, it's the attitude in this county that there are people that think they don't have to comply and don't care if they're putting other people at risk.
Yeah.
It's not about, you're not, as Dr. Aiken said, you're not protecting yourself by wearing a mask.
Right.
You're protecting the people you
Right.
come in contact with.
I understand that. I understand.
And if people aren't willing to do that, I'm not saying not open up this county.
Yeah.
I'm saying, let's have some regulations, let's have some procedures in place that make it sensible and safe to do that. Ultimately, I have to protect the staff at my hospital because they come in contact with everybody that's tested positive in this county. Now, if you overload my staff, which we had a very serious incident this week involving one of the COVID patients that could have exposed a lot of our staff, but we handled it. That's where my concern is. Don't ever tell me I don't care about this community. I turned this hospital around. That hospital's open because I came here and turned it around.
That hospital, if we look
So
at your
I
financials
am
for the last
willing
2
to
months, I get
negotiate-
you that it's a different story.
No, you're wrong.
I'm also willing to negotiate if moving it forward with the face covering, mask, whatever that, I think moving it forward is better than not having a plan to move it all.
Right.
Because if we don't move
Yeah,
it all,
we've got to move in a direction. And I think part of some people in this community's inability to buy into the protection of others as well as themselves is, I think, our low rate. I think everybody has heard of the pandemic, the epidemic, oh my goodness, everybody's going to die. It hasn't happened here yet, and I'm grateful for that. I'm terribly grateful
And
for
I
that.
think, and honestly, I truly believe this. I think it's because of what we did.
Well,
It's because a lot of people.
We don't know that for sure.
But-
The attitude of this community is great. This is the strongest community you've ever probably stepped foot in. So to say that, well, the attitude of this community, you don't have to live here.
But I think there's some truth in that. I think people here have responded to a lot of the things and the
Absolutely.
directives that they've heard from the governor and the health people in our community. They've responded. A lot of people, I notice in the stores, they recognize the social distancing. I see that being practiced in different ways. But it's difficult, I think, for them, especially we're into this game, 6 weeks, going on 8 weeks now, that we're not in the pandemic in Montezuma County. We're not, but that's not to say it can or won't happen. I understand
Right.
that. But it's hard to buy in when you don't see that much activity in this county from it. But when you can make your face covering is to protect others against you, and I understand that. Bandanas, whatever you want to wear, scarves, bandanas, whatever keeps your moisture droplets from going from you to somebody else, you're protecting them, not
it's just a
protecting you.
face covering because obviously masks are in short supply, they're hard to get.
True.
Right.
I mean,
And
so
it says
so
face
it's gonna
covering
be
in
Right.
your document, so.
So now's your
Alternative masks.
opportunity
So-
to dress up and do bandanas, do whatever, so. if
The way the board works is there's a vote. So two wins.
I understand.
That's how it works.
I got you. But
Keenan,
we've got to
so-
get buy-in. We've got to get buy-in from our partners in this community.
And just one thing, and I hear what you're saying about the low numbers, and I agree that it's hard to wrap your head around that. But one thing I think we need to remember with those low numbers, we've had 2 deaths
Yeah.
of those 16. That is high. So
But those
I'm just saying that that's significant.
Understandable, Bobby,
So-
but both those cases were very compromised people too. They had
There were 2 deaths.
underlying medical conditions that brought them to that precipice more rapidly than a normal healthy.
There's a
human.
lot of counties, though, that have had maybe vulnerable populations that are positive as well, but haven't had the deaths.
Well, but look at
So, I'm
Montrose,
just
they've got
saying
80-some
we need-
cases and 36 deaths, so, I mean, it just depends on who's getting I mean,
The-
I
the
understand.
the
Yeah, I just don't want to
comorbidity-
minimize the
Yeah,
fact
that's
It
that-
person
has
to
to be-
person.
So,
it has to be realized, and I understand.
Oh,
that.
that's very
And
true.
there's a-
Yeah.
And we're not saying that, we're still saying, you know, the vulnerable people still need to really be extremely cautious, pay attention. The guidelines out there, you know, our nursing homes are still, Joyce reported the other day.
Right,
still
there's no
have nothing there,
visitation,
so
that's right.
That's
The
great.
Assisted livings are
That's
locked
great,
down and.
but I think that is gonna continue for them.
It is.
So if we can get at least a plan submitted, I guess I would be willing to negotiate to ask the people if they can go back to work to wear a covering or.
When they
however
engage
stated
the
it.
public,
When
they
they
have some
engage
kind
the
of face
public.
covering on when they engage the
I would
public
be
in their
willing
business.
to ask that, to move the plan forward.
Well,
Is that-
it's my understanding you already have it in here. We-
Yeah,
we
it's
said
it's in the plan.
Yeah,
It is,
we already
but
have it in.
it's that with the enforcement, I guess, is the.
Is the critical part of it,
is the
yeah, that it
critical
actually
part
going to
of
be,
it, Which is,
yeah.
I would still like to go be able to talk to a business right away if we're notified. I think as a group, that's part of prevention to get them out there, because a lot of people haven't read that public health order. That thing is
A lot of them never will read that.
a lot of,
No,
a lot in
34
there. But we
pages.
have to be able to educate them and show them that prevention.
Oh, I agree.
So if we're good with that, then I think we can move on, and you can actually probably move to your agenda item next if you would like.
Well, that would be the discussion of the trigger points, which
Did
I
we
think we've
hit
already
all
discussed
those?
that.
Yeah, I think we did.
We did not discuss what would move us into phase two and loosen restrictions even further.
I think,
I think our health, what would warrant saying, okay, it's time to go to phase two. We've implemented this program, this plan that we're doing, that we're proposing now, was approved by the governor. We've done this plan for 2.5 weeks, 3 weeks. COVID patient numbers have gone up incrementally, let's just hope for the best scenario. We didn't see any large increases in COVID. How long would we have to operate in this phase before then we say, okay, restaurants, you can go to 60% capacity or 75% capacity. Gyms can do the same thing, and
we only
do it,
have,
or
it
do we-
we only have it written as 60%.
60 is what's in the
Yeah.
plan, yes.
Okay.
So 40 to 60, so we would increase 20%. And the only thing that you had there again, so we can discuss the trigger point, and I don't know there again that has to kind of come from the recommendation of you all of what.
Given the way that the virus works, from the time that somebody gets infected to the time they show symptoms, and as it spreads in the community, it's going to take a minimum of 3 weeks from the time we do any relaxation to determine whether or not we're seeing an impact of an increase in number of cases. So that would be the minimum period of time that we would want to wait before we would consider moving to phase two. My thought would be that we should have another discussion. It wouldn't have to be a formal Board of Health meeting after 3 weeks to see where we're at and to determine whether it looks like it would be safe to move further on into phase two.
Because
So-
nationwide, even in the
You're
hot.
saying submit the plan and then follow up every 3 weeks to see what it looks like?
Well, at least in the first after the first 3 weeks. I think that we could have a much better idea as to what impact phase one is having after 3 weeks.
Is that?
I think that sounds logical. I mean, again, that does follow the pattern of the virus, so, and
So
At that
if
point,
we-
we would look and see where we're at. We'd know for sure where we were at with our testing supply chain. We would see how many more cases
Right.
have occurred. We'd have an opportunity to see if there was any additional impact on the management of these cases at the hospital. There's a number of things to consider. What's happening in the Navajo Nation in 3 weeks? In Farmington is listed in national newspapers as one of the 10 worst places in the country right now for the number of cases and deaths per capita. The Navajo Nation has the 3rd highest per capita rate of COVID-19
But
disease.
the
in
counties,
nation.
the counties that boundary us are the Apache and San Juan. They're not as extreme as it is further on into Tuba City on into the
And 3
center.
weeks from now,
Yeah.
we could see that that's dying down, the threat to our community is better. Things that we're doing here have, hopefully gone very well for us.
Okay.
I mean, again, we want this to be a
So
successful.
21 days, 3 weeks would be reasonable or logical to meet that criteria to submit the plan. Right, so if approved and we do move forward with the 40%, 3 weeks, 21 days after that, then we would reevaluate for phase two.
move to phase two.
3 weeks. 21
Sounds
days.
logical.
Because the national trend is coming down. I mean, I think with summer, warm weather, sunshine, that ultraviolet light is hard on the COVID. I know, that's what I am too. I am too, Dr. Rankin.
There's a lot that we don't know.
I know, and every positive thing that I can see, I'm hanging on to it, man.
This would be so much easier, so much easier if we had everything before us and knew exactly
know,
what to
yeah.
expect.
Yeah, we're dealing a lot in the dark here. I mean, we're dealing in the dark to a large degree.
We are,
don't know,
absolutely.
Yeah.
But 21 days is logical. I
That
can
sounds
live
like
with that.
sounds like a good period, and then we look at it, see where we're at from the health department perspective, see how people are complying with what we're doing, and I'm good with that.
You didn't have anything listed, Bobby,
And,
there?
and as far as enforcement goes, this brings up a very good point. If all the businesses are aware that we don't move to phase number next without compliance, they're more likely to shoot for a goal than they are to be beat with a stick.
That's true, Shaq. I think if they see by them buying in and complying with what we're asking, then it's gonna pay them off possibly in 3 weeks with a better deal, then I think you're right. I think that's a good carrot to have out there for them.
I really.
Well, Walmart will be your first one, because I can tell you what, I'd bet anybody at the ranch, we can go right now, get in separate vehicles, we can go walk through Walmart, we'll find a violation.
But I'm sure of that, Larry Don, but I know at least Walmart's doing a count. They're doing a store count. And Ron Kinesic there at Walmart, I think, and I imagine it came from corporate, I don't know, but they said you need to count how many people are in your store. And Walmart's doing that. I don't see that at City Market and some other places. They're not counting the number, they're not keeping that spacing or the numbers of clients in their store, but at least some of them are trying. I mean, I'll give Walmart credit that they're trying to do. They've got their counters there, people counting the numbers in and the numbers out. So they're making an attempt, and so.
And I guess that's what I'm saying, and I agree with you, Commissioner, that if we move it forward, we have to educate them, which is part of the prevention that we're doing right now.
And nothing
And
will
that
be perfect.
Here
Nothing's
is
going to be perfect.
Here is our plan. If we can make this happen, you've got 40 now, in 3 weeks or 21 days after that, we could possibly up that to 60%.
And then the
obviously-
governor may change,
and then
depending on what the governor
Right.
thinks, he may see some things, some trends changing, he may change his stuff too.
Yeah, he may open it wide open or make it 70%. I don't
Yeah.
know, and then we're good to go. So
Let's go for a vote with the Board of Commissioners on the plan as is. It looks like everybody's in agreement. The plan as is, to move it forward to CDHP.
Could I make one quick comment before you have to vote? And that would be about the restaurants. Could we do what I think you suggested, a stipulation of maybe a week to see if we can't get this rapid testing going? That's the only thing that makes me nervous about the restaurants, because that's such a high risk of droplet transmission.
I think that, and I don't know how CDPHE is reviewing this stuff, but once we clean this up, we could get it submitted, but
We don't know when it's going to come back.
Shaq, what is it going to take for them to get it back to us?
Well, a lot of that depends on who its desk lands on at CDPHE. In my past experiences submitting things to CDPHE, which is the Solid Waste Division and not the Public Health Division, is that it can take from a couple of weeks, maybe even to a month. But I do want to take this opportunity while we're speaking to everybody in YouTube land, that if the Board of Health approves this tonight, and if the health department and the hospital sign off on it and it's submitted to CDPHE, that doesn't mean that you open up right away. We still have to wait for CDPHE's approval. And
That's
I
correct.
think at the bare minimum, we are looking at a 2-week turnaround, and maybe faster. They did Mesa County in about a week and a half, but that was before other counties were
In the pipeline.
So I think we're looking at a minimum of probably 10 days, which hopefully, I know we're all being optimistic that we get that and that you get your 150 tests for the Abbott machine.
And that would be
We're
5
saying-
days before the restaurants would open from the 15th anyway.
I mean, that gives us some time where I would feel much more confident that we will have more tests.
Okay.
So with the changes that were made in here, I guess I'm looking at public health and the hospital. we could move this plan forward.
Yes, I guess
Is there anything else that,
the confusion would be is, I mean, this actually does specify the rapid testing availability. Is that what we're going to leave in there, or we?
Well, I think we leave it because we have rapid testing capabilities at present, Tony. We've got the Abbott machine, which and we've got enough tests that we've got rapid testing right now. If Bobby's successful in getting more kits, we're still in compliance with that. Just we may not have the number of, we can't test 150 people, but we've got rapid testing available.
do you feel that you
Tony,
will have tests in a week?
I feel like if we're looking at a 2-week
I
lead
hope
time.
so, but I didn't get a call back, and I was.
We should have the
Call back,
BD max by then.
Yeah.
So
This is what we can
actually
do.
have
Well, we can't do that, but
2 rapid tests, there's different,
Yeah, there's two potential
but there's 2
options,
potential
yeah.
with plenty of tests
Yeah.
and the machine. You have to have them
I
both
think
to
it's
move it
safe
forward.
Safe to leave it as worded as it
Okay.
is, if we're looking at without 2 weeks at a time. I don't think we'll be shooting ourselves in the foot with that.
all right. Is there a motion on the floor?
I move that the Board of Health move this proposition forward on the new draft and our changes to this draft from the CDPHE, that we move this forward as soon as possible.
And you have all of those, Shaq, all of the changes that you got them all?
I have all of the changes. It's gonna take me most of tomorrow to get this organized into a cleaner copy for everybody to sign.
Okay, and I'll second that then.
So we got a motion and a second to approve the draft as present. All those in favor?
Aye.
Aye.
I'm going to say aye too, because I think the plan is going to change over time. All right.
Well, I guess we need a motion to adjourn.
Well, I want to thank everybody. I think our community is going to thank us for this too.
And I would also thank everybody for at least coming in here to try and move something forward. I know it's stressful for everybody, but I really believe it's in the best interest of our community to at least try to move something forward because of where we live geographically. And, we have the 2,040 square miles. We're not condensed into 500 square miles or 50 square miles. And it's a plan. At least we're trying to move something forward. It may get rejected, but we're trying. So I would thank you also.
Just, Mr. Adjourn, so these are just a couple of informal comments, but I think we can handle the testing part. We'll figure out where we're going to go with that and do our very best to have it in place. The contact tracing part and the enforcement part, I think we just need to make sure that we really have a clear idea. Shaq mentioned about hiring more nurses to help with contact tracing if they're needed. Want to make sure that you gentlemen are buying into that as a possibility.
The county's gonna do whatever it takes to get the
Three of
This
us
is,
may be
yeah.
contact tracers.
Where-
Show me where to go. I want to be a detective.
But the three of you can help with enforcement. Visiting the businesses.
I think you have pretty much all three of us that we're gonna work to help her. We want our community function and going, and if it requires for a short period of time more help for her, then that's what we're faced with. But that's probably down the road, and it may never happen. We'll cross that bridge when we get there, but we are on board that if it does need to happen, then we have to, we have to get more firefighters in.
Okay, that sounds fine.
Depends if they
I'm
have
satisfied with
experience.
that.
Let's say they have experience in coming out to some.
I have three people that has agreed to do contracting with us, but they're not gonna do it full time. I plan on setting up a meeting, going over all the documents with them, so that they're ready to go when we need them. But if, the county's gonna pick up the price tag on that, that would be helpful. The other issue would be for the enforcement piece and education piece. I've got a couple of staff internally that we could probably use to get out and pound the streets and, help educate. Because Melissa can't do it all. septics are starting up, you know, I mean, all of her normal work is starting up. So, you know, but again, there is a need to pay those people that I have internally, because they're not doing their current jobs, they're doing this job. So there would be money needed to pay if we are going to do.
I think that's just the proposal that you have to send to us at that time.
Yeah.
People that we have closed down, we'll pay them.
So,
That's exactly right. Well, the thing is the people are, 99% of the people are going to do whatever they can to be as safe as possible. You're going to have a speeder every once in a while. So I believe in the people that live here, and they're going to do the right thing. And I don't think that it's going to be a big deal.
And Bobby, I think Jim has asked everybody that is putting in extra time, extra hours, and extra things on this COVID-19, which this absolutely is, to log those hours, record them in the, and well, I understand that, but those may be FEMA reimbursables from, so we understand that. That I don't think we need to get hung up on a dollar here, a dollar, and having
I
to do
think
things.
our
differently.
statement from this commissioner is that we are going to do what it takes to be able to help our people in this community move forward in a safe, logical, healthy manner.
And can I add to that? The health department will do whatever they can do. So we've talked to several businesses. Do not be afraid to reach out to us, ask us questions. There is no stupid question. We are there to help you all. So just reach out to us.
Coming this week, you're expecting guidance specific to graduation. That's a huge milestone in everybody's life, right? And so the graduations, they're not going to say no to graduations. They're giving us guidance so that we can do it safely.
But what if they didn't go to school for the last 2 months? Are they still going to graduate?
They're going to school. I know that for a fact.
My granddaughter's graduation is July 30th in Grand Junction. Wow. That's what they've got it scheduled for, so.
At least
Everybody's going to
everybody
get to have it.
Yeah.
All right, thank you all.
Thank you.
I would
Thank
make
you.
a motion that we adjourn.
There's been a motion on the floor to adjourn.
I thought we did. I second that.
Motion is second to adjourn, all in favor?
Aye. It's a tough time for all of us. Thanks, Tony.
Thanks, Tony. Have a good night.
You guys have a good night.
Thank you.